Mental health, first aid and depression. Depression is a common mental health issue that impacts a significant number of people all over the world. Depression is characterized by recurrent emotions of melancholy and hopelessness, as well as a loss of interest in activities that a person formerly took pleasure in. Depression has the potential to have an effect on a person's relationships, their ability to operate normally day to day, as well as their place of employment. The manifestations and indicators of depression might differ from one individual to the next, but the following are some of the more typical symptoms of depression. Having feelings of depression or hopelessness that won't go away. Diminishing interest in activities that were formerly pleasurable. Alterations in appetite and weight. Trouble sleeping or excessive sleeping. Tiredness or a lack of energy. Difficulty focusing or coming to a conclusion when necessary. A persistent sense of inadequacy or remorse. Ongoing contemplation of one's own demise or suicide. There are a number of treatments available for depression. However, the treatment that is most likely to be successful for an individual depends on the symptoms they are experiencing as well as the degree of their condition. One or both of psychotherapy and medicine, or even a mixture of the two, are potential treatment choices. Cognitive behavioral therapy, sometimes known as CBT, is a common form of talk therapy that aims to assist patients in recognizing and altering the negative thoughts and behaviors that play a role in the development of depression. To further assist in the management of depressive symptoms, a specialist in the field of mental health may additionally prescribe medications such as antidepressants. Alterations to one's lifestyle, in addition to psychotherapy and medicine, are among the many things that patients with depression can do to better control their condition. These may include the following: regular exercise, getting enough sleep, eating a nutritious, well-balanced diet, practicing relaxation techniques like meditation or mindfulness, and keeping an eye on your drinking habits. It is essential to keep in mind that depression is a medical condition that can be treated, and consulting a mental health professional for assistance is an essential step on the path to managing and conquering depression. If you or someone you know is having trouble dealing with depression, please do not hesitate to seek help for yourself. Depressed people can benefit greatly from receiving mental health first aid training. The goal of mental health first aid training is to prepare participants to identify, approach, and help a person who is experiencing a mental health crisis or difficulty. Depression affects many people, and those who have received mental health first aid training not only have a better chance of helping those around them, but also of recognizing the signs and symptoms of depression in themselves and others. Training in mental health first aid can teach people to recognize the signs of depression and how to help others who are dealing with it. Training in mental health first aid can also assist people to learn to have productive conversations with depressed friends and family members and to point them in the direction of suitable mental health resources. People who have received mental health first aid training are better able to recognize the signs of depression in themselves and others, and they are also better equipped to help those around them who are experiencing depression. Training in mental health first aid can benefit with depression in the following ways. The first step in treating depression is recognizing its symptoms, which include chronic sadness, a lack of optimism, and a loss of interest in previously enjoyed activities. Responding to depression. Mental health first aid training can equip people with the knowledge and tools they need to help others who are experiencing mental health crises, including depression. Helping someone who is depressed requires knowledge of how to provide practical assistance, such as pointing them in the direction of resources, encouraging them to seek professional help, or assisting them in developing coping mechanisms. Self-care is promoted via mental health first aid training, which helps people with depression learn practices like mindfulness, relaxation, and exercise to better cope with their condition. Mental health first aid training can contribute to reducing stigma by promoting an understanding of the impact of mental health issues and delivering correct information about depression to individuals. In conclusion, the practice of mental health first aid can educate people about depression and equip them to effectively aid those who are experiencing it. By educating the public about depression and its treatment, we may foster a culture that is more accepting of those who struggle with mental illness. Thanks for watching. Like, share and subscribe. Check out Mental Health and Life for all your training needs.